Good evening, good afternoon, good morning to all, wherever you are. So we'll start the webinar in about a minute as a commemoration to World AIDS Day. Okay, we are now on clock. So welcome to the webinar to commemorate the 2024 World AIDS Day. And may I ask the team to change it to the housekeeping slides? And there is a chat function where you can put in your questions that we will take at the end of the panel discussions. Without further ado, I would like to introduce you the first speaker, Dr. Suman Rijal, Director of the Communicable Disease Department of the WHO Regional Office for Southeast Asia. So there is a live transcript at the bottom of the webinar. You can click it on live transcript and choose show subtitle, and the caption will appear on the screen. So one of our speakers will be speaking in Burmese with English translation, so we can do that. But closer to that, we will remind everyone as well. Next slide. So the session will be recorded and your attendance is consent to be recorded. Session materials will be uploaded into the ECHO platform. Your feedback is important to us and a survey will be shared at the end of the session. Next slide. So this is from ECHO because we normally analyze just where you are, but your individual data will be kept confidential. This is really to help us to understand where participants comes and become more focused on responding to your needs. Next. Okay, then let's start with the World AIDS Day webinar. We thank the panelists that are already online, and may I invite Dr. Suman Rijal to have the welcome remarks and objectives of the event. Over to you, Dr. Rijal.
Thank you, Dr. Chang. I hope you can hear me clearly.
Yes, very well.
Okay. Good morning, good afternoon, and good evening, everyone. I would like to extend a very warm welcome to this WHO Southeast Asia Regional Office webinar to commemorate the 2024 World's AIDS Day. This is a public webinar where WHO brings speakers from all areas to share their perspectives and experience so that we can hear from diverse voices in our journey towards ending AIDS by 2030. This year, World's AIDS Day theme is Take the Right Paths, My Health, My Right. We are very happy to have an excellent group of speakers, including young people whom will be speaking in their perspectives. Without further ado, I would like to share the remarks of Ms. Saima Wazid, the Regional Director of WHO Southeast Asia Regional Office, and I quote. Today, December 1st, we gather with a purpose and passion to observe World AIDS Day 2024. The World Health Organization stands shoulder to shoulder with partners and communities around the globe, calling on leaders and citizens to champion the fundamental right to health. Together, we must confront the inequalities that hinder our journey towards achieving the Sustainable Development Goals targets of ending AIDS by 2030. This year's theme, Take the Right Path, My Health, My Right, is a rallying cry for accessible, rights-based healthcare that empowers those affected by HIV/AIDS to live vibrant and fulfilling lives. A rights-based approach is not just a strategy, it is a commitment to uphold the dignity, health, and autonomy of every individual, especially those with vulnerabilities and are most at risk. We must boldly tackle the stigma and discrimination that stand as formidable barriers to accessing prevention, treatment, and care. WHO is dedicated to creating environments where everyone, regardless of their HIV status or social identity, can access the services they need without fear or exclusion. Empowering communities and civil society are essential in amplifying the voices of those at heightened risk, fostering a supportive framework that intertwines human rights with health outcomes. Marginalized populations continue to bear the brunt of this epidemic, facing disproportionate impacts due to stigma, discrimination, and in some cases, criminalization. HIV rates are particularly high among key populations, such as men who have sex with men, sex workers, people who inject drugs, trans and gender diverse individuals, and prisoners. It is crucial that we address the social, economic, legal, and cultural inequalities that hinder access to HIV services for all. Prioritizing those left behind and dismantling discriminatory laws are essential steps towards achieving our global HIV targets and realizing the universal right to health. As we reflect on the current landscape, we recognize that 13.9 million people globally live with HIV and 1.3 billion new infections were reported in 2023, far exceeding the 2025 target of fewer than 370,000. In the WHO Southeast Asia region alone, there are approximately 3.9 million people living with HIV, representing 10% of the global burden. In 2023, 78% of PL-HIV in the region knew their status, 66% had received life-saving antiretroviral treatment, and 64% had suppressed viral load among people living with HIV. While we have made significant strides in reducing HIV/AIDS rates through strong national commitments, we must acknowledge the ongoing challenges that persist. Champion countries such as Maldives, Sri Lanka, and Thailand have achieved elimination of mother-to-child transmission of HIV and syphilis, and there needs to be intensified work in other countries to accelerate on the triple elimination of vertical transmission of HIV, syphilis, and hepatitis B. In this region, 80,000 children and adolescents aged 0 to 14 are estimated to be living with HIV. Approximately 53,000 infants are born with congenital syphilis. These children are one too many. They face a multitude of complex issues while growing up living with the HIV virus. For many young people who contract and live with HIV, the journey is fraught with challenges that extend beyond the medical aspects of the virus. The emotional impact of an HIV diagnosis can be profound for them and their families. There is shock, fear, isolation, and stigma. These make it difficult to stay safe and healthy. Furthermore, while new infections among young people have generally declined, some countries are witnessing troubling increases where nearly half of new infections occur, particularly among young key populations aged between 15 to 24 years. Young key populations face unique hurdles in accessing healthcare. Many lack comprehensive sexual education. Overall, less than a quarter of young people in the region know how HIV is transmitted and acquired, and even fewer know about sexual transmitted infections. This gap in knowledge can lead to increased vulnerability as young people may not seek testing or treatment due to misinformation or fear of stigma. The recent adoption of a ministerial declaration on adolescents' responsive health systems on October 8, 2024, by countries in the WHO Southeast Asia region marks a significant commitment to building inclusive health systems that cater to the needs of young people. This aligns with our World AIDS Day theme, reinforcing the rights of every young person affected by HIV. Empowering youth through rights-based approaches involves ensuring access to youth-friendly services, comprehensive sexual education, social and legal protections, and meaningful involvement in decision-making processes. In line with this, we must ensure the inclusion of young people, especially those who are most at risk, in setting policies and services so that delivery of services and interventions are tailored to their needs. The WHO Southeast Asia region is steadfast in its commitment to achieving the 2030 target of ending AIDS. Achieving this requires collaboration amongst governments, international organizations, donors and partners, healthcare providers, civil society, and most importantly, those most affected. On this World AIDS Day, let us reaffirm our commitment to the health and rights of all individuals affected by HIV/AIDS. By taking the rights path, we do not only advocate for health equity, but also empower communities to stand up for their rights. Let us unite in our efforts to ensure that every young person and every individual living with HIV/AIDS can proudly declare, "My health, my right." Thank you. Now, with this, we'd like to move on, and I would like to invite Dr. Eamon Murphy, the Regional Director of UN AIDS Asia Pacific and Eastern Europe and Central Asia region, for his remarks, please.
Thank you, Dr. Suman Rizal. I hope you can hear me well.
Yes, we can.
Great, thank you. That's very good. Firstly, colleagues, it's a great pleasure to be with you this afternoon, and I'd like to thank Dr. Pauline Chan and other colleagues who asked us to join you. I do feel slightly wrong choice for this first presentation when we're talking about young key populations, but I feel like I'm the oldest online. But I'm very pleased that the panel that WHO SEARO has pulled together very young people from across the region and at the country level who can talk from first experience about the realities of being young key populations today. Dr. Suman talked about the epidemic and the nature of what's happening across our countries. And in Southeast Asia, SEARO region, the lives of young people are changing dramatically every day through cultural, social, political issues that are happening, and how they communicate today and their lives are very different to the lives of young people 10 or 20 years ago. Let me turn to our presentation to help set the scene. On World AIDS Day, the new UNAIDS report, and when I say UNAIDS is a partnership of UN agencies, including WHO. This report emphasizes that ending AIDS as a public health threat by 2030 is possible, but only if leaders prioritize the human rights of those living with or those at risk of HIV. And the report, can we go back one slide? You're jumping ahead of me, sorry. The report titled, "Take the Rights Path to End AIDS," highlights that despite progress, and we have very good progress across the response to HIV across the world, but despite this progress, the human rights violations remain a major barrier to ending AIDS, and particularly for young people in our societies. When there are impunity for gender-based violence, when people, including young people, can be arrested for who they are or who they love, when a visit to a health service is dangerous for people because of the community they are from, the result is that people are blocked from being able to access HIV services or other essential health services that they need for their lives. Through the 2021 political declaration on HIV/AIDS, UN member states committed to reducing punitive laws and policies to less than 10%, lowering stigma and discrimination for key populations to less than 10%, ensuring that less than 10% of women, girls, and key populations experience gender inequality or violence. These are challenging reductions they have made commitments to, and I doubt we have many countries that are on track to achieve these targets. And that's something that young people today need to take up with their leaders in society and in government to challenge that we need to see progress on this if everyone is to enjoy the full fundamental rights, including the enjoyment of the right to health. Protecting everyone's health requires protecting everyone's rights. So now, if we turn to the next slide, we can then look at young people and why the focus on young people. Why taking the rights path is very important for young people across the full Asia Pacific. Every hour, 9 young people acquire HIV. Every day, 9 young people die from AIDS-related illnesses today. This is shocking and unnecessary in today's world with the type of treatments we have, the access to services that should be in place. So these are challenging realities that we have to deal with. In 2023, there were 82,000 new infections among young people, which accounted for 27% of total infections. Young people are disproportionately affected by our HIV epidemic today. Next slide, please. At the bottom of this graph, it shows in Myanmar, Indonesia, Thailand, and the Philippines, around half of new HIV infections occur among young people, highlighting again the urgent need for targeted and nuanced interventions, which is why WHO SEARO is focusing on young people in today's seminar. What is it that's needed to help reach young people with information and to help them access the services that they need? Similarly, in Cambodia, Laos, PDR, and Vietnam, more than 1/3 of new infections are among young people, underscoring this necessity to curb the epidemic within this population group, these young people. To the left of the slide, you can see we have rising new infections among young people in countries as diverse as Papua New Guinea, Afghanistan, and the Philippines. Young key populations are especially vulnerable. The prevalence among young men who have sex with men has at least doubled in Indonesia, in Malaysia, and in Vietnam across the full Asia Pacific region, not just SEARO region. Slide 4, please. Next slide. The inadequate access to prevention services is shown on this graph, and it'll take a while. You can have copies of these graphs to have a look at where your country is placed and the populations within them. It shows that young key populations have inadequate access to prevention services which are critical. The left side of the slide shows that access to prevention services is below 50% for most key populations in most countries. And this is a real worry because prevention services are the most essential. We can't treat our way out of the epidemic. We have to be emphasizing the need for prevention. And we have new tools that are coming online, and working with WHO, we'll be working to support the access to these over time, such as the new long-acting injectables, which are both for prevention and treatment, but they're not available yet in our countries and certainly not at affordable prices. Next slide, please. The vulnerabilities of young key populations arise from various factors that result in limited or no access to essential services. These include the harmful social and gender norms, reinforcing inequality, the gender-based violence and stigma for young people living with HIV and other vulnerable groups, including in our societies, young women and girls, young people with disabilities, and young migrants. The legal, structural, and policy barriers. These include age-related restrictions requiring parental or spousal consent for accessing services. In some countries, the age of consent for sex is lower than the age of consent, permission to access HIV testing. So we have some problems within our legal and our policy frameworks. There are issues around criminalization of behaviors associated with key populations, such as same-sex relations, sex work, or drug use. These barriers discourage health-seeking behaviors and hinder access to HIV, STI, and sexual reproductive health services. The stigmatizing and discriminatory attitudes of our healthcare providers in some settings and in some countries discourages many young people from key populations from seeking the essential health information, HIV related, and services. Many young key populations report avoiding healthcare due to prejudice or discriminatory attitudes of the staff that should be there to support and help them. The lack of youth-friendly health services, we do have a limited range and availability of services tailored to the unique needs of young key populations, including the integrated sexual reproductive health and rights work, the mental health and harm reduction programs. Also, limited comprehensive sexuality education. Comprehensive sexuality education informs people. It reduces the misconceptions about HIV. Comprehensive sexuality education is found to increase the use of HIV testing services amongst adolescents and young people. Additionally, factors such as poverty, race, ethnicity, religion, education, and gender-related inequalities are significantly impacting young people's access to services and increase their vulnerabilities. So fulfilling young people's right to health requires a holistic approach that combines the policy reform, the stigma reduction, the capacity building, and innovative service delivery models to ensure young people have equitable access to essential health services. Today, we need access on our phones. We don't need fixed sites. Young people live in a virtual world and need to access this information when they need it and how they best receive it. Next slide, please. Let me just turn briefly to the issue of criminalization. There are legal barriers to the HIV response across the full Asia-Pacific region. 38 countries criminalizing aspects of sex work, 17 same-sex relations, 28 drug possession, 20 countries criminalize HIV transmission, exposure, or non-disclosure. 14 restrict the entry and stay and residence of people with HIV. It varies how these laws are used or how they're enforced, but the fact they exist hampers people, and particularly young people's access to essential services and restricts their opportunities in life. It's critical to support young key populations to access prevention, testing, and treatment services. But this criminalization has the opposite effect. It reinforces stigma, deters care and seeking behaviors, and perpetuates HIV vulnerabilities. The very existence of the laws, even if they're not enforced, intimidates people from accessing their rights to health. For young people from key populations and those living with HIV, these are the real reasons to remain fearful and hidden. Repealing the laws requires that criminalize or otherwise discriminate against key populations, including our young key populations. It's an urgent human rights and public health imperative. We need to work together on this critical issue and change these laws. Some countries have repealed laws or made amendments, such as India, Singapore, the Cook Islands, but we're a long way from it, where other countries are introducing new laws, such as Indonesia, that will further impact the lives of young people today. Next slide, please. In the area of stigma and discrimination, one slide back, you've jumped one. Thank you. There's an interplay between these laws and societal attitudes. The existence of these laws encourages negative societal attitudes towards sex work, towards the issues of young people who have sex with, young men who have sex with other young men. For example, this stigma and discrimination is manifest and the laws perpetuate it. Stigma and discrimination have profound negative impacts on the health and well-being of the key populations and of the success of the AIDS responses for young people and other groups. This slide shares select findings from Stigma Index 2.0 reports and behavioural surveys in a range of countries. In Thailand, a quarter of young people living with HIV reported HIV-related stigma and discrimination in health settings, which is just one example. I encourage young people across the countries to engage in the Stigma 2.0 report processes that will occur. Next slide, please. Upholding the rights begins with seeing young people whose experiences count, recognizing that young people are not just the beneficiaries of services, but they are co-creators in how best to reach them and their peers. Young people from key populations are more likely to use and benefit from HIV services when they and their networks are involved in designing, in providing and monitoring of these services. Young people today understand the needs and concerns of their peers better than older service providers. You know how and where to reach them and are more likely to earn the trust and the well-placed to devise the suitable solutions for young people's lives today and the reality of their situations. Just sharing a couple of examples from the region, Youth Lead, and we'll hear from Ika after me, has developed a regional healthcare manual for workers and young key populations. They are piloting this approach to build the capacity of existing health services to reach and, importantly, to retain the clients, the young clients in their services. In Nepal, YKP has is implementing capacity building programs and young people living with HIV and for young key populations, empowering them with essential skills and knowledge on HIV prevention and treatment. So it's designed by young people for young people. In Indonesia, Intermuda focuses on tackling the stigma and discrimination towards young key populations under 18 years. They successfully advocated for a policy revision, allowing adolescents under 18 to access HIV services without parental consent if accompanied by an adult. This progress is reflected in the Ministry of Health's updated regulation 23/22. So it shows the power of young people and what they can achieve if they work together with government and other partners. But there are challenges, of course. The participation of young people from key populations in national HIV programs varies. Much of it's focused around the review and updating of the national strategies or plans and in consultations on the strategy documents. The more routine involvement in the policy making on how to implement these strategies and the monitoring is still limited, and that's critical to change. Young people know best how to encourage other young people to access services that are suited for them. There are currently few formal organizations or networks run by young people from these key populations in the region. And services led by young key population groups are few in number, small in scale and short on funding. Most countries don't have policies that enable community-led organizations, including the YKP-led organizations, to be registered, which render these groups ineligible for other funding. So we need to see social contracting and reforms in this area to allow young YKP led organizations to engage. Next slide, please. Recommendations here are coming from young people themselves. These are a set of recommendations from policymakers and HIV programs to address the challenges that YKP face. These recommendations have been discussed by a wide range of partners, including youth-led organizations, governments, and technical partners from 11 countries in the region during the workshop, which included training on accelerating HIV and STI prevention for young people from key populations in Asia and the Pacific, was jointly led by Youth Lead with the support of WHO and UNAIDS. And so these recommendations here are coming from young people and are designed for young people. The first is unfettered or open access to prevention, including pre-exposure prophylaxis, advocating for lowering the age limit for young people's access to prevention and sexual reproductive health services, removing human rights barriers and reforming the laws and the policies hampering the young KP's access to services. Adopting and expanding innovations. Young people today, Generation Z, have grown up in a fast-paced world of technology and digitalization. Utilizing virtual interventions in innovative services can attract young people's attention to the HIV prevention services, including PrEP and HIV self-testing, to promote new generation leaders and champions, to rekindle the value of activism, speaking out for the issues that affect you as young people by empowering a new generation of leaders who are bold, who are vocal and passionate, but well-versed also and supported by organizations like WHO and UNAIDS and Youth Lead to understand the issues affecting them in health, HIV, and sexual reproductive health. These multi-sectoral approaches, these partnerships are critical for us, implementing strategies to reach young people in schools and out of schools, including the workforce, both through formal and the informal sectors. And who best placed to reach people in the informal sectors but other young people? Engaging the youth-led organizations, not just in those strategic document development, but the planning, the implementing, and the monitoring of programs, the nature of how we reach young people today to ensure that the programs are inclusive of young people and most effective for their health outcomes, and to collect and use disaggregated data on young key populations for advocacy. The HIV response is at a crossroads today. If urgent action is not taken, new HIV infections among young people will be higher in 2030 than they are today, threatening the progress across the Asia-Pacific regions and the human rights that are critical for the future of our societies. We can end AIDS among young people, but only if we take the rights path and if we walk it together and are guided by young people themselves. Thank you very much for allowing me to join this important discussion. I look forward to hearing from the panel as we go forward. Thanks.
Thank you, Eamon, and thank you for a wonderful presentation and really an eye-popping analysis of the epidemics that's going on in Asia and the Pacific among young key populations. Now, without further ado, I would like to invite Ms. Ika Novianti from Youth Lead to talk about the highlights from the regional consultation in your own words from the young. So over to you, Ika.
Thank you so much, Dr. Pauline. Hi, good afternoon, everyone. As Pauline mentioned, my name is Ika. I'm the Regional Coordinator of Youth Lead, the Young Key Population Network in Asia and the Pacific. It's an honor for me to be here today as we reflect on the challenge and progress in our fight against HIV and AIDS, especially we mark World AIDS Day, time dedicated to raising awareness and renewing our commitment to ending the epidemic. So as Eamon mentioned, back in September, we had the privilege of hosting one of the impactful event of the year, accelerating HIV and STI prevention for young people from key population. So this event brought together young leaders, advocates, and stakeholders to tackle some of the most pressing issues in HIV and STI prevention. Today I'm excited to share the key highlights from this milestone, gathering and exploring how its outcomes align with the theme of the World AIDS Day this year. Take the right path, my health, my right. Next slide, please. So during hosting this event, we are not alone as a youth-led organization, but we are jointly do this event with WHO and also UNS regional support team for Asia and the Pacific. Next slide. So this event aimed to address critical issues related to HIV and STI prevention among young people, particularly those from key population. From key population. Practical solution to expand HIV and STIs prevention, access, accessibility, and uptake for young people from key population. So the participants include young leaders and civil society organization for the first day, and then the joining the next 2 and 3 days we are joining by the government representative, delegates from the country in Asia Pacific, including Bangladesh, Cambodia, India, Nepal, Vietnam, Indonesia, Laos, Myanmar, China, Thailand, and the Philippines attending this workshop. The delegation comprised the young leaders, youth representative, 1 to 2 government official, and representative of UN agencies such as UNAIDS and also WHO. Next slide. So the workshop focused on enhancing HIV and STI prevention strategy for young key population with the following key objective. First one is build a shared understanding of young key population needs, develop actionable country roadmaps, promote youth-led HIV intervention initiative, strengthen partnership among young leaders, governments, and also development agency. So I will try to make it really fast, not fast, like summarizing the 3 days event. Next slide. Yeah, so the day 1 of the workshop gather youth-led organization, civil society, UN, regional and country office. This day focus on engaging young key population and CSO to reflect on the progress, challenge, and also unmet needs in HIV and STI prevention across ASEAN and the Pacific region. So the introductory session focused on setting the ground rules, participant expectation. Also, we had a collaborative group work session. So youth participants, they share their perspective, map key stakeholder for HIV and STI prevention at country level, identify allies, neutral, and opponent stakeholder. They also do a brainstorm team and suggested like solution after that to present to the government for the next day. So during the session, participants highlighted the numerous barriers for young people that they face in countries, such as restrictive policy, as Iman mentioned, societal stigma and discrimination, and also diminishing global funding for essential prevention tools such as condom and lubricant. This discussion set a stage for forging innovative collaboration solution to enhance access to prevention service and strengthen effort in the HIV and STI response. So we also did a comprehensive mapping exercise to emphasize the need for tailored strategies to engage allies effectively, convert neutral parties in supporter, and also address the concern posed by the opponent. Next slide. The second day of the workshop concentrate on strengthening youth engagement in the HIV and STI prevention initiative. The key discussion underscored the necessity of incorporating youth representation in decision-making process, also addressing stigma and discrimination, and utilizing technology to enhance the outreach effort. Participants presented various case studies from various countries, highlighting the challenge and also effective strategy in addressing the needs of young key population. So during these days, we also did the World Cafe session to share the case study from countries. So this session provides unique opportunities to explore the successful country-specific project targeting the HIV and STI prevention among young key population across the region. So each country shared the project goals, challenge, key result, best practices, and also recommendation. Like for example, participant from Thailand, they share project title, Involvement of Thai LGBTQ Youth in Youth-Friendly Sexual Reproductive Health Services. So this program is undertaken by the Center of Excellence for Pediatric Infection, Disease, and Vaccine, the School of Global Health, the Department of Pediatric at Chulalongkorn University, the name and the Body CU Clinic in Bangkok. So this clinic or this project is operating at the national level. This initiative focused on increasing the involvement of the LGBTQ youth in youth-friendly sexual reproductive health services. The second example I would like to share with you is from Nepal, that they present the project titled Bridging the Transition, Empowering the Children Affected by HIV/AIDS Through Holistic Approach to Adulthood. Is being implemented by the YKP Lead Nepal. This project is focused on the local level, aiming to empower children and adolescents affected by HIV as they transition to the adulthood. The initiative seeks to address significant gaps in support of this individual through a holistic approach, enhancing their access to essential service and promoting better understanding of their needs. So overall, lesson learned from this activity is project across Asia and the Pacific underscore the value of youth-centered approach, peer-led initiative, community engagement, and targeted advocacy for effective HIV prevention for young key population. During day 2, we also discuss around the Global Fund investment for young key population in Asia and the Pacific. We invited the representative of the Global Fund and other partner who work with the Global Fund to discuss on the investment for young key population in country from the Global Fund. So the discussion highlighted the importance of integrating youth perspective in the Global Fund process, emphasizing the needs for target investment in young key population across the region. Also, the speaker discussed various strategies for enhancing community engagement and ensuring that the youth voices are heard in the decision-making process related to health program funded by the Global Fund. Next slide. Okay. So the third day of the workshop, we focus on updates regarding the MPOX session and emphasize capacity building for young key population. So participants engage in the group work discussing strategy to enhance the effectiveness and sustainability of YKP-led organization. The key area focus include innovative funding strategy, capacity building initiative, and the crucial role of youth in health decision-making process. The group session also produced actionable insight for improving advocacy effort among young key population. Yeah. So next slide. So for 3 days of workshop or event, we did also, come up with the common barriers and also lesson learned of the HIV and STI prevention work in the country. Some of the common barriers is like stigma for the young people accessing the SRHR and also HIV services in the country. Also, there is lack of youth-friendly services in most of the country, and also limited resource for the youth-led organization to run their advocacy work. And also lesson learned that we have discussed from the 3 days discussion is like we need strong partnership and innovative outreach model are crucial as well. Tailor health services to improve accessibility and impactful for the young key population and young people. Next slide. So as I mentioned before, during the 3 days, we also develop a country roadmaps. So the goal for the country roadmap is to expanding comprehensive education and integrated services. Also to improve policy and resource allocation to make it more like friendly for the young people needs. So action that we can do in the future is like having more digital tools and also digital advocacy, and having more and more community-based approaches in the country level. Next slide. So these are some recommendations that I pulled together during these 3 days. So first is policy development and advocacy for YKP friendly services. It is essential for country to focus on developing policies and advocating for HIV and STI prevention services that are both accessible and youth-friendly for young people in order to enhance healthcare and prevention initiative. Service integration, country should make effort to integrate HIV and STI prevention into service use and value for young population and young people, including SRHR services, mental health, gender-based violence, and other differentiated service delivery model should be used to support access and accessibility of these services. Last but not least, data disaggregation, as Eamon mentioned before, and also development and dissemination of HIV, STI prevention information, focus on creating, adapting, and implementing HIV, STI prevention materials through both traditional and also digital platform, emphasizing return to foundational principle for effective outreach and impact. Next slide, please. As the regional network for Yankee population in Asia and the Pacific, YouthLead identified next step action as a result of the discussion workshop. So which are, first is YouthLead will collaborate with the Asia and Pacific Learning Hub to ensure that countries in need a short-term technical assistance from the Global Fund can tailor through this mechanism to address their need and support. The second one is follow-up the regional recommendation from this event to our next annual general meeting to seek any experience from other youth regional or global network as inputs to refine the work plan of Yankee population in the ASEAN Pacific region. The third one is ensuring that the HIV and STI intervention for Yankee population are stated in the Asia and the Pacific Regional YKP strategic plan that we are still on process of development. And the last one is utilizing existing platform like the Asia Pacific Learning Hub, the Regional and Global Youth Consortium, and also like other task team that we already that have been existing for the Yankee population. Next slide. So as conclusion, this regional forum brought together youth representative, government, ministry, and also development partners to tackle the pressing issue surrounding HIV and STI prevention among Yankee population. Through thoughtful and comprehensive discussion, we identify common challenges such as limited access to youth-friendly services, lack of awareness about prevention, and inadequate healthcare infrastructure. However, we also recognize valuable solution during this workshop, including the power of strong partnership, leadership development, and also innovative service delivery models tailored to the unique needs of young people. So the outcome of this workshop will serve as a cornerstone for ongoing effort to strengthen healthcare service for YKP. With immediate action plan, we are committed to ensuring that the insight gained here translated into tangible improvement. Establishing a community of practice and organizing follow-up country-level meeting will help sustain our collaboration and track progress effectively. In conclusion, this workshop has successfully laid the groundwork for meaningful change. Together, we have initiated a roadmap for future initiatives that will enhance the health and well-being of Yankee population. So yeah, let's carry this energy forward to create lasting impact for young people in the region. Thank you so much. Back to you, Dr. Pauline.
Thank you so much, Ika, and thank you. This is truly inspiring. And I have to say that when you talk about action and meaningful partnership, meaningful action together, it is wonderful to see the stewardship and the leadership from the young and Yankee populations to address the very complex challenges that we have today. But before we go on to the moderated discussion that Agatha from Youth Lead and I will be moderating, can I ask Echo to come up with the Menti QR code? So I have a question for everyone. There's more than 90 people on the call now. Please scan the QR code and join at menti.com or use the code. In the chat box, we will also put in the QR code and the code for Menti. This is an open link to menti.com. And the question is, what is the one word or words that comes to your mind when you think about my health, my right? You can input your words anytime during this webinar and during the discussion with the panelists. Now, without further ado, I hope you have scanned the QR code. It is also available on the chat. So now we will proceed to the wonderful panel that we have today from young speakers. So Agatha, over to you.
Thank you so much, Dr. Pauline. Hi, everyone. Happy World AIDS Day 2024. I hope you are well. Nice to meet you all. My name is Agatha. I am the project officer at Youth Lead, the regional network for young key populations in Asia and the Pacific. And I will be the moderator for today's panel discussion with amazing activists and speakers. So first, I would like to check in with our first panelist, Natapon from Thailand. Hi, Natapon. Are you here?
Okay.
Hi. Okay.
Hi.
So everyone, Natapon is a person living with HIV who has openly shared their status with the world, actively working in policy advocacy and communication to platforms like TikTok. Natapon is the online media manager in Bangkok Pride, who also campaign for and drive other important causes such as marriage equality in collaboration with various organizations. Additionally, they are a part of the organizing team for Bangkok Pride 2023 to 2024 in Thailand, the first country in Southeast Asia to legalize same-sex marriage, where rights are recognized. Happy to have you today, Natapon. So I want to ask, as an online campaign manager, how do you ensure that information reaches those who need it the most?
Uh, I am Natapon Ditabanjong now. I am nicknamed Pangpon. Today we used to work in online manager in Bangkok Pie. But to Bangkok Pie, I to build to the Rainbow Pie Parade. Designed to 2022. Now there's to Bangkok Pie is to push in marriage inequality law, but I am to work in to manage content and to video clip and media planner in policy campaign and to online campaign go to push to online in Bangkok Pie. But I to build and founding to TikTok channel to talk with HIV topic. But people living with I am people living with HIV and to talk to questions in you you equal you you equal you and to living with HIV to mental health with people living with HIV for other topic. Now to I think to opportunity to start my HIV advocacy journey by speaking and on the TEDx session you must into 2020 2017 yeah okay but to between to advocate in reform sorry but to working and to advocate in HIV topic yeah but go to this talk in TV in online and in newspaper in 2017 go to now only yeah 2024 was to I share story by exploring question and finding answer to myself but people living with HIV. My channel now to follower in 7,000 follower but to overall clip in TikTok channel into 500,000 total view. Yeah. Regarding to HIV advocacy, particularly promoting condom use, and I personally focus my campaign on LGBTQIA+ community, but to focus in men who have sex with men, but MSM. When asked how to ensure information this, the target audience effectively, my answer, what be that we need to build our community and consistency, monitor feedback, through comment in direct messages in TikTok, in Instagram and Facebook and Line. Yeah, to our channel, to direct message, question to testing, yeah, and counseling. You equal you was to drug for HIV was to HIV treatment. Yeah, same. And to include from author channel to understand the type of question or concern begin raised. Yeah. So I start running online campaign. I have observed that my video have reached online, popular directly and indirectly. Yeah, this has allowed me to provide advice and counseling and reach key populations. Everywhere when the content reach audience outside the target group, and this still have the potential to draw the intended audience by making content that is engaging enough to write them in. Sorry. That's as I resume result to this campaign, people who we are previously and to people living with HIV great better understand to you equal you and detectable and detectable equal and transmittable concept. That this has been achieved through interconnect online channel, such as my role as control to the You Equal You and Me project, to which produce video and communication directly with target population through partnership with new agency. The momentum in Thai new agency was I to counselor in project. You Equal You and Me, these two project with collab with to Love Foundation. Sorry, this founding to Love Foundation and Me Too Counseling, and partner with the momentum to create video clip for the Momentum Agency and the Foundation to speak in You Equal You with transgender, with men's sex with men, and to our people this knowledge go to people living with HIV this to normal life in You Equal You in Thailand. Okay. But I also create video content for my own channel in TikTok, in YouTube, in Facebook, in Instagram. Yeah. But every day me to direct message for question for counseling to 20 consult case in the day. Yeah, in per day. Additional, I have estimate communications for people living with HIV, thought the live open chat name body pass which serve as a space for exchanging news, useful information, and providing support. Now, this in the group line open chat body pass have over 600 people member. Sorry, 600 member has to be active for 4 years, but to 600 people in the body pass member go to now is people living with HIV this to 90% in member in the group. Let's say I believe that to in HIV advocates the most important aspect is not just with reaching the target populations, but also create the new communications, news community, and value every group in mutual understand this approach ensure that HIV related issue are addressed inclusive for everyone. Thank you.
Thank you so much, Natapon. Let's move to the next speaker. We have Raksita from India. Hi, Raksita.
Sir, thank you for ಈ ಗ್ರೂಪ್ ಅಲ್ಲಿ ಮಾತಾಡೋಕೆ ಅವಕಾಶ ಮಾಡಿಕೊಟ್ಟಿದ್ದಕ್ಕೆ ಥ್ಯಾಂಕ್ಸ್.
Hi everyone. Namaste. I am Rakshita. Before starting, I would like to thank everyone for giving me this opportunity to share my experience.
ನಮಸ್ತೆ, ನನ್ನ ಹೆಸರು ರಕ್ಷಿತಾ ಅಂತ. ಸಿಕ್ಸ್ ವರ್ಕರ್ ಮತ್ತೆ OW ಆಗಿ ಕೆಲಸ ಮಾಡ್ತೀನಿ. OW ಆಗಿ ಕೆಲಸ ಮಾಡ್ತಿದ್ದೀನಿ. ನೆಟ್ವರ್ಕ್ ಸಿಕ್ಸ್ ವರ್ಕರ್ ಆಗಿ ಕೆಲಸ ಮಾಡ್ತೀನಿ. ಸುಪ್ರೀಂ ಕೋರ್ಟ್ ಬಗ್ಗೆ ತಿಳಿಸಬೇಕಾ?
I am Rakshita. I am 26 years old. I am a youth committee member in All India Networks of Sex Worker. And now I would like to share something about the Supreme Court order.
ಸುಪ್ರೀಂ ಕೋರ್ಟ್ ಆದೇಶ ನೀಡಿದೆ. ಅದರಿಂದ ಏನೇನು ಸಲಹೆ ಪಡ್ಕೊಳ್ಳೋ ಬಗ್ಗೆ ಅಂತ ಆಲ್ ಇಂಡಿಯಾದಲ್ಲಿ ಈಗ 60,000 ಕಮಿಟಿ ಹೆಣ್ಮಕ್ಳಿದ್ದಾರೆ. ಅದ್ರ ಚಿಕ್ಕ ವಯಸ್ಸುಗಳಿದ್ದಾವೆ. ಅದ್ರ ಸಣ್ಣ ಗುಂಪುಗಳಾಗಿ ನಾವು ಚರ್ಚೆ ಮಾಡ್ತಾ ಇದ್ದೀವಿ, ತಿಳಿಸ್ತಾ ಇದ್ದೀನಿ.
Already each and every sex worker community women knew about the Supreme Court ruling and the orders. So to know, to pass this information, we already conducted more than 60,000 covered 60,000 sex workers and covered all over countries. And in a small group meetings, we already thought about the Supreme Court ruling.
ಡಾಕ್ಟರ್ಸ್ ಅಂದ್ರೆ ಹೆಣ್ಮಕ್ಳಿಗೆ ತಾರತಮ್ಯ ಅಂದ್ರೆ ಆರೋಗ್ಯ ಬಗ್ಗೆ ತಾರತಮ್ಯ ಮಾಡಿದಾಗ ಒಂದು ನಿರ್ವಹಣೆ ಅಂತ ಇರ್ತಾರೆ. ಅವ್ರ ಬಗ್ಗೆ ಅವ್ರ ಜೊತೆಗೆ ಚರ್ಚೆ ಮಾಡಿದಾಗ ಅವ್ರ ಇನ್ನೊಬ್ರು ತಂಡಕ್ಕೆ ಹೋಗಿ ಅಂದ್ರೆ ಲೀಡರ್ ಬಗ್ಗೆ ಹೋಗಿ ಚರ್ಚೆ ಮಾಡ್ತಾರೆ. ಅವ್ರು ನಮ್ಗೆ ಆರೋಗ್ಯ ಬಗ್ಗೆ ತೋರ್ಸ್ಕೊಳಕ್ಕೋಸ್ಕರ ಸಹಾಯ ಮಾಡ್ತಾರೆ.
Whenever our sex workers community or visiting healthcare centers or hospitals to avail the services which are available, when we are from our side, we are placed volunteers like healthcare navigators. They will support our community members when those who visited the healthcare centers, and they'll have a good rapport with the doctors, their supervisors, and healthcare service providers.
ಏನೇನ್ ಸಹಾಯ ಪಡ್ಕೊತಾ ಇದೀವಿ ಅಂದ್ರೆ ಎಲ್ಲೆಲ್ಲೂ ಸುಪ್ರೀಂ ಕೋರ್ಟ್ ಆದೇಶನಾಗ ಏನೇನ ಸೌಲಭ್ಯ ಪಡ್ಕೊಡ್ತಿದ್ದಾರೆ ಅದನ್ನೆಲ್ಲನೂ ಸೆಕ್ಸ್ ವರ್ಕರ್ಗೆ ತಲುಪಿಸ್ತಾ ಇದೀವಿ.
Yeah, our sex workers knew that our health is our right. So to access that rights and receive a good services, whichever getting for other patients without any stigma and discrimination, we are getting all these services from our healthcare navigators in the healthcare settings.
ತಿಂಗಳು ಒಂದ್ಸರಿ ಆಲ್ ಇಂಡಿಯಾದಲ್ಲಿ ನೆಟ್ವರ್ಕ್ ಅಲ್ಲಿ ತಿಂಗಳಿಗೊಂದ್ಸರಿ ಮೀಟಿಂಗ್ ನಡೆಸ್ತಾ ಇದೀವಿ. ಅದ್ರ ಬಗ್ಗೆ ಏನೇ ಯಾರೇ ಆಗ್ಲಿ ಪೊಲೀಸರಾಗ್ಲಿ ಡಾಕ್ಟರ್ಸ್ ಆಗ್ಲಿ ಮತ್ತೆ ಆಲ್ ಇಂಡಿಯಾ ಯಾರಿಗೆ ನೆಟ್ವರ್ಕ್ ಅಲ್ಲಿ ಇದ್ದಾರೆ ಅವ್ರಿಗೆಲ್ಲ ಕುತ್ಕೊಂಡು ತಿಂಗಳಿಗೊಂದ್ಸರಿ ಮೀಟಿಂಗ್ ನಡೆಸ್ತಾ ಇದೀವಿ. ಅಲ್ಲಿ ಆಶಾದವರು ಲೀಡರ್ಸ್ ಇರ್ತಾರೆ, ನಾವು ಸೆಕ್ಸ್ ವರ್ಕರ್ ಒಬ್ರು ಲೀಡರ್ಸ್ ಇರ್ತಾರೆ, ಡಿಸ್ಕಸ್ ಮಾಡ್ತೀವಿ. ಏನಾದ್ರು ತೊಂದರೆ ಇದೆ ಅಲ್ಲಿ ಸಲಹೆಯನ್ನು ಪಡ್ಕೊಡ್ತಾರೆ.
Actually, we are covering.
Thank you so much, Raksita. Can you hear me?
Can you hear us, sir?
Yes.
Hello.
Yes, we can hear you. Yeah. So before we continue, I would like to ask, so from your experience, because in 2022 the Supreme Court of India issued a landmark order recognizing the rights of sex workers. So as a young leader in the sex worker community, how do you ensure that this ruling is effectively utilized to improve access to health and other essential services for young sex workers in India?
ಇವಾಗ ಅವರು ಕೇಳ್ತಾ ಇದ್ದಾರೆ, ನಿಮ್ಗೆ ಆಸ್ ಎ ಸುಪ್ರೀಂ ಕೋರ್ಟ್ ರೂಲಿಂಗ್ ಬಗ್ಗೆ ಗೊತ್ತಿದೆ, ಆದ್ರೆ ನೀವೊಂದು ಹೆಂಗ್ ಸೆಕ್ಸ್ ವರ್ಕರ್ ಆಗಿ ನೀವು ಅದನ್ನ ಹೆಂಗೆ ಆಕ್ಸೆಸ್ ಮಾಡ್ತೀರಾ, ಸರ್ವಿಸಸ್ನ ನೀವು ಹೆಂಗೆ ಅದನ್ನ ಪಡ್ಕೊಳ್ತೀರಾ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಅವರು ಪ್ರಶ್ನೆ ಕೇಳ್ತಾ ಇದ್ದಾರೆ. ತೊಂದರೆ ಆಗಿರೋದನ್ನ ಹೆಂಗೆ ನೀವು ಎಲ್ಲರಿಗೂ ಕೊಡಿಸ್ತೀರಾ?
ತೊಂದರೆ ಆಗಿರೋದು ಅಂತಂದ್ರೆ ಈಗ ಸುಪ್ರೀಂ ಆದೇಶ ನೀಡಿದೆ ಅಲ್ವಾ, ನಮ್ಗೆ ಹಿಂಗ ಬಂದಿದೆ ಕೂಗಳು ಅಂತಂತ ನಾವು ಅವ್ರಿಗೂ ಧೈರ್ಯ ತುಂಬ್ತೀವಿ. ಮತ್ತೆ ಸುಪ್ರೀಂ ಕೋರ್ಟ್ ಇಂದಾನೆ ಲಾಯರ್ ಇರ್ತಾರೆ, ಅದರಿಂದ ಸಹಾಯ ಪಡ್ಕೊತೀವಿ ನಾವು.
Actually, everyone is known about the Supreme Court ruling, the rights and rights of the sex workers. Sometimes if they face any problems related to service providing centers or in social entitlements, any other issues, we'll seek a help from the local doctors or local government agencies to solve their problems.
Okay. Thank you so much, Raksita. I would really want to hear more, but we have to move to our next panelist since we have to be very mindful of the time. So to continue the discussion, I would like to pass it to Dr. Pauline.
Thank you, Agatha. And we have the next panelist, Suhana from Nepal. Perhaps you can have a self-introduction, Suhana, and then we will ask you the question. Over to you, Suhana, for your short self-introduction. Could you please unmute? Thank you.
Namaste, hello, and good afternoon, everyone. I'm Sona Thapamagar. My pronouns are she or her. I'm 26-year-old and I'm from Nepal and LGBTIQ+ activist. As a transgender woman and social influencer, I work at Cruises Nepal under USAID HIV Community Services activity funded by USAID. My role focuses on promoting health, HIV, STI prevention, treatment, support services, including PrEP services, mental health counseling. I actively participate in forums like the Asia Pacific Youth Forum for Sustainable Development and Youth Dialogues on Climate Action. Thank you.
So Suhana, Nepal has been really progressive on same-sex relationships and has now legalized same-sex marriage. I mean, this year has been many firsts. Thailand having the same-sex marriage, Nepal being the first South Asia country to have same-sex marriage. It's truly remarkable today. So have you observed any reduced discrimination or stigma in health services for the trans and LGBT since these legal changes? Over to you.
Thank you, Pauline. Nepal has achieved a historic milestone as the first South Asian country to legalize same-sex marriage. This step reflects Nepal's progressive stance on equality and inclusion. However, as we celebrate this achievement, it is crucial to think deeper into its implications, especially for the transgender community. The current legal framework primarily focuses on same-sex marriage, but we must ask, does it recently address the need of transgender individuals? Access to essential services such as gender-affirming healthcare, mental health support, and social acceptance remains limited due to pervasive stigma and discrimination. The inability to formally register marriage for transgender individuals not only denies them social and legal recognition, but also increases public health risks, for instance, without legal recognition. Individuals in committed relationship may face barriers in accessing health benefits and HIV prevention services. This can result in a higher likelihood of multiple partnership and increased risks to HIV and other STIs. However, as we celebrate this achievement, it is important to think deeper into implications, particularly for the transgender populations. While the focus for this legal framework has largely been on same-sex marriage, we must ask, does this recognition access to transgender-specific service as gender-affirming healthcare, mental health support, and social acceptance still remains limited due to pervasive stigma and discrimination? The inability to formally register marriage for transgender individuals not only denies them social and legal recognition, but also increases public health risks. Instance, without legal recognition, individuals in committed relationship may face barriers to accessing health benefits and HIV prevention services. Thank you.
Thank you, Suhana. It is a very pointed thing, is that once there is legal protection, everything else falls in place. And that's why the policy is so critical, and the legal and law provisions as well in every country. So it was also pointed out by Eamon from UNAIDS, and it was remarkable to see the amount of criminalization in countries in the Asia Pacific region. Thank you very much for pointing that out. So we'll now move on to the next panelist from Myanmar. Tete, Tete, if you can unmute yourself. And I think for those, there is a translation on the bottom part. You can look for interpretation. So Tete, could you please introduce yourself shortly, and we'll ask you a question. Thank you.
အားလုံးမင်္ဂလာပါရှင်။သမီးရဲ့နာမည်သမီးကတော့မြန်မာနိုင်ငံမှုရေးစေဝါသုံးစွဲသူများကွန်ရက် NDN မှာအဖွဲ့ဝင်တက်တက်ဖြစ်ပါတယ်ရှင်။သမီးရဲ့နာမည်ကမတက်တက်ဖြစ်ပါတယ်ရှင်။သမီးအသက်ကတော့22နှစ်ဖြစ်ပါတယ်ရှင်။သမီးဒီအသက်15နှစ်အရွယ်ကမှုရေးစေဝါကိုစတင်သုံးစွဲခဲ့ပါတယ်ရှင်။မတရုံတောက်တာလည်း2နှစ်ရှိနေပါပြီရှင်။
So, Raymond, are you there for translator? Raymond? Yes, Raymond, can you unmute and just speak on the translation, please? Thank you. Is Raymond there? Yeah.
Yes.
Yes, okay. The translator can be heard in the English channel. I just remind you. Thank you, Tete. So I have a question. As a young leader, how do you ensure your community has access to accurate prevention information and to utilize the harm reduction services in your country? Thank you.
ဖွဲ့ဝင်တယောက်အနေနဲ့ဘဝတူအမျိုးသမီးများရဲ့လိင်မှုဆိုင်ရာတာသက်ချာနေမျိုးဆက်ပွားမူရည်စင်းနေနောက်ဆက်တွဲပြဿနာများကိုအတိအပေးပညာပေးများပြုလုပ်နေပါတယ်ရှင်။လူငယ်အမျိုးသမီးမူရည်စေဝါသုံးစွဲသူများအနေနဲ့ကျန်းမာရေးဝန်ဆောင်မှုတွေအမြဲလာယူနိုင်အောင်ဘယ်လိုလုပ်တင်လဲ၊ဘာတွေလုပ်တင်လဲ မူရစေဝါသုံးစွဲသူတွေကိုပြစ်ဒဏ်ပေးတဲ့ဥပဒေတွေရှေးရိုးဆွဲအတွေးခေါ်တွေခွဲခြားနှိပ်ချကဲ့ရဲ့ပြစ်တင်ခြင်းတွေပြောင်းလဲဖို့မရှိဖို့လိုအပ်ပါတယ်ရှင်။မြို့သမီးမူရစေဝါသုံးစွဲသူများနဲ့ကိုင်းညီရဲ့ဝန်ဆောင်မှုတွေအမျိုးသမီးတည်တံ့ဝန်ဆောင်မှုတွေလည်းရှိသင့်ပါတယ်ရှင်။နောက်အဓိကအချက်၄ခုနဲ့လည်းပြည့်စုံရပါမယ်ရှင်။၁လုံလောက်မှုရှိရမည်၂လက်လန်းမီရမည်၃လက်ခံနိုင်တဲ့အရေးအသွေးရှိရမည်၄အဆင့်မီရမည်လုံလောက်မှုရှိရမည်ဆိုသမီးတို့တွေ NGO တွေကိုသွားတဲ့အခါမှာအမြဲတမ်းကြုံတွေ့နေရတဲ့ပြဿနာတစ်ခုကတော့ဆေးတော့ကုန်တာတွေမွေးရည်ဘူးမရှိတာတွေအယ်ကိုဟောဘက်မရှိတာတွေအဲ့လိုမျိုးတွေကြုံတွေ့ရပါတယ်ရှင်သမီးတို့ပတ်ဝန်းကျင်မှာလည်းသမီးတို့ပတ်ဝန်းကျင်မှာကုသမှုလက်လန်းမမီတာကြောင့်လက်လန်းမမီတာကြောင့်ထိခိုက်ခံစားမှုတွေလည်းရှိနေရပါတယ်ရှင်ခွဲခြားနှိပ်ချဆက်ဆံမှုတွေမှာအနိကဆုံးဖြစ်တဲ့မိသားစုဝင်များနဲ့အဖွဲ့ဝန်ဆောင်မှုပေးနေသောအဖွဲ့အစည်းများရဲ့ခွဲခြားနှိပ်ချဆက်ဆံမှုတွေကအဓိကဆိုးဝါးစွာကြုံတွေ့နေရပါတယ်ရှင်။နောက်အဓိကဥပမာအနေနဲ့ပြောပြရမယ်ဆိုရင်သမီးကြုံတွေ့ခဲ့ရတာလေးပြောပြပေးချင်ပါတယ်ရှင်။သမီးဒီလွန်ခဲ့တဲ့2022လောက်က NGO တစ်ခုမှာစီပိုးကုသမှုကိုခံယူခဲ့ပါတယ်ရှင်။ဒါပေမဲ့သမီးကိုပျောက်ကင်းစင်ဒီကုသမှုမရရှိခဲ့ပါဘူးရှင်။သမီးတွေမှမဟုတ်ဘူးအခြားလူတွေလည်းဒီလိုမျိုးပျောက်ကင်းစင်ဒီကုသမှုမရရှိခဲ့ပါဘူးရှင်။ဒါကြောင့်သူတို့ပြောထားတဲ့အတိုင်းပျောက်ကင်းစင်ဒီကုသပေးဖို့လိုအပ်ပါတယ်ရှင်။မူရစေသုံးစွဲသူတွေအတွက်စီမံကိန်းလုပ်ငန်းတွေစစ်တမ်းတွေမှာလည်းမူရစေဝါသုံးစွဲသူများရဲ့အတန်ကိုမယူပဲလွယ်လင့်တကူလှုပ်ဆောင်နေတာတွေကိုလည်းတွေ့ရပါတယ်ရှင်။ဒါတွေကလည်းလုံးဝမဖြစ်သင့်ပါဘူးရှင်။သမီးတို့ကိုဝန်ဆောင်မှုပေးတဲ့လုပ်ငန်းတွေမှာဥဆောင်ခွင့်ရမယ်ဆိုရင်ပိုပြီးထိရောက်ပါမယ်ရှင်။မူရစေဝါသုံးစွဲသူများစီမံကိန်းလုပ်ငန်းတွေမှာစတန်တွေမှာလည်းမူရစေဝါသုံးစွဲသူများရဲ့အတန်ကိုမယူတော့ပဲလွယ်လင့်တကူလှုပ်ဆောင်နေတာတွေကိုလည်းတွေ့ရလူကြီးများကိုအထူးပင်ကျေးဇူးတင်ရှိပါတယ်ရှင်။
Thank you, Miss Tay. I have to say that you are operating in incredibly challenging situations and getting people to access services is incredible. So congratulations on whatever you do. It's a lot of effort, but the outcome is wonderful. So without further ado, I'm going to pass the baton on back to Agatha. She's doing the heavy lifting. So the next panelist will be from Timor-Leste. Agatha, back to you.
Thank you so much, Dr. Pauline. As Dr. Pauline has said, so our next speaker is a young person from Timor-Leste. It's Fernando. Hi, Fernando. Can you introduce yourself before I ask you a question?
Obrigado. Ao Ninaram Fernando de Araújo, idade 24 anos. Ao EMA MSM, never narani a comunidade de progresso. Ao minha posição agora, a nessa peer leader ba programa MSM no transgênero, no a minha base ihadili.
Thank you. My name is Fernando de Araújo. I'm 24 years old. I work in the Associação Comunidade de Progresso as peer leader for MSM and transgender program, specifically located in Dili.
No tinan rua kotuk liba ao recrutado hanesam peer educador ba projeto piloto PrEP no HIV self-testing.
Last year I was recruited as peer educator through a grant from UNH in collaboration with UNFPA and WHO.
Ia tinang kotuk hau nudar voluntari ou peer educador ba programa PrEP no HIV self-testing no hetan.
Last year I'm also a peer educator for the program HIV self-testing and PrEP program piloting project in Timor-Leste.
No hetan treinamento
Over to you.
Okay, thank you so much, Fernando. So, your organization is leading the work with the national HIV program for key populations, with the support from the national program and the global fund, and then you said from UNAIDS and UNFPA, and you have implemented the HIV self-testing and PrEP demonstration project for all the key populations group. Can you share your experiences as a young leader in implementing the HIV self-testing and PrEP program?
Pwede fare fare esperienza con la implementazione programma durante involvimento in PrEP, programma PrEP non posso HIV self-testing oppure naturale. Kita dengan mesti honest split. Sampai confirm.
Ia tinang kutuk hang da period kedor bahai vessel text no prep no no hetan treinamento na tong husi introduz con aba prep no high vessel testing ba comunidade MSM no TZ.
Last year I was recruited as peer educator for PrEP program in HIV self-testing, and we also received training, basic training on HIV, on PrEP and also HIV self-testing.
Lio si encontro a minha superior programa SEARO, a minha tene con aba indicador ema nebe tem que alcança durante o projeto piloto implementa.
Through meeting with the program supervisor, we are able to know the goals to be achieved during the implementation of the PrEP and HIV self-testing pilot program.
No ami começa a alcança a minha comunidade, ao hare lio siba comunidade MSM, alcança SEARO no refere, SEARO hodi acesso ba teste HIV no continua refere SEARO ba ia PrEP, carik SEARO eligible hodi foti PrEP.
Basically, I'm working, I'm reaching MSM community, I'm reaching and also refer them to do an HIV test. If they are eligible, I will refer them to receive PrEP.
Iene se conta con una buona esperienza durante l'involvimento e il programma PrEP no HIV self-testing.
I will share my little experience during involving in PrEP program and also HIV self-testing.
Ami socializa informação SEARO com a PrEP no HIV self-testing ba a minha colega SEARO. Barak mak antusias teve so PrEP no maneira testazen. Nebe se ofereceu-se comunidade progresso. Nomos contende teves a tuhili maneira prevenção e o si fotipil no halo teste anrasik.
We starting refer the beneficiaries we started with the beneficiary who will refer to receive HIV PrEP in second month of. I was dedicated to reach MSM and transgender community and refer them to do HIV tests and refer them to receive PrEP if they are eligible. Here, the first thing that what they do is they visited MSM or hotspot in Dili and conducted counseling to the importance using PrEP to prevent, and also all the community and also their community, their friend, very enthusiastic receive the information about the PrEP and also HIV self-testing.
Maybe quando depois de a minha alcança, colega Sirane refere Siraba teste. Hawa soro desafio when hira ia colega barak questiona quando hare Sirane colega Sircelo que tan efek samping depois hemu PrEP.
After refer them to PrEP, but there are challenges that we face during referring them to taking PrEP medicine. Also, some of my friends that taking PrEP was affected with side effect during taking the PrEP.
Efek samping sir hanisam balung ulung moras o inhalai Cavum Moras no batirak ne halo colega Siracelo tauk depois rona isu hirak ne.
This affect like vomit and also headache. It's make other MSM is really scared to take in PrEP.
Agradece a minha tulun husi médico no enfermeiro ne be tulun husi WHO belelais hatamba isu ne liusi tratamento hasoru efek samping nebe oin hau menciona.
But greatly, we have nurse and also a medical that support by WHO, helping them with the treatment, treated for the side effect.
No, cada voluntário la sala cada voluntário tem que alcança tos sanulu pode refere bahai vetel self-testing no PrEP.
And also, each volunteer that working for PrEP, they have to reach 5 to 10 person, refer them to taking PrEP in a month.
Haula dun lembra ona emanain hirama kau refere ba foti PrEP, mas be total ema MSM hotizi nebe foti PrEP ia momento neba hamutu 233 comunidade.
I don't remember anymore how many I have referred to get PrEP and do HIV self-testing, but I still run in my mind total key population who have taken PrEP in 2023.
Yeah.
233 for key population that taking PrEP.
Ia fulam 1 Februari 2023 hareba daru sirakne halo ami contente no ne motiva ami atual alcança tan colega sira selu kodi foti PrEP.
Looking at those data, it's make us really happy to reach more beneficiary or reach more our friends to use or taking PrEP.
To fim de ano 2023 ami consegue atingir duni indicador nebe pomai equipe tarjeto 200 ba PrEP, mas be ami atinge 233, MSM 83, FSW 94, TZ 35, no trabalho sexo humano 21.
In the end of the project or in the end of the year, we achieved all the target that was given to us. So it's 200 key population must be reached, and also we achieved more than 200. We achieved 233 key population that taking PrEP during the year.
Total
Okay.
MSM nebe continua foti PrEP hahusi fulan primeiro.
Fernando? Sorry, I have to cut you because we are running out of time and we still have more speakers, but thank you so much. I'm so sorry once again to cut you, but we have to move on and be mindful of the time. Once again, thank you so much for sharing your wonderful experience with us. Next speaker, we have Amit from India. Hi, Amit. Can you introduce yourself before I ask you the question?
Hi, am I audible properly?
Yes.
So, hi, this is Amit Bisoi. I go by with all pronouns and no pronouns. I identify myself as a homosexual gender fluid person. And I work in an organization named Sathi, which stands for Solidarity and Action Against the HIV Infection of India, as a regional program specialist under Project Vistara. And this project is based on building up or upscaling network for LGBTIQ plus community through evidence-based advocacy. And this project has been implemented through 9 states. So I am managing the 3 states, Odisha, Andhra Pradesh, and Telangana. And I am based in Bhubaneswar, Odisha. And I am 23 years old. And sorry, not 23, I'm 27 years old. And I'm living with HIV since 2 years. And I am also a drag artist who is promoting safe sex practice and sex positivity through my art form.
Thank you so much, Amit. So, how do you engage with the stakeholders to reduce stigma and discrimination in the healthcare setting? Could you share any examples or success stories?
Okay, so as a person who is living with HIV, who is also a member of the LGBTIQ plus community, I and those who feel experience the similar layers of stigma and discrimination. In the Indian context, while stigma and discrimination relate to sexuality and gender identity, it's somewhat less in the HIV primary prevention programs. It is still high among the medical providers at the ART centers and other departments. Most other medical providers in disciplines other than STI and HIV harbor stigma and ignorance when it comes to sexual and gender identity, gender diversity, as well as HIV. To address this, we at Sathi have been working for the past 22 years to sensitize healthcare providers on issues of key populations as well as HIV. My teams and I have engaged through continued medical education programs with pediatricians, gynecologists, surgeons, endocrinologists, and general physicians on the issues of homophobia, transphobia, and HIV-related prejudice. And we have an immediate response to crisis intervention when contacted by people who have been exposed to the HIV by sexual assault or condom breakage. We link them to the clinics for immediate post-exposure prophylaxis initiation. We also promote access to pre-exposure prophylaxis, which is only available on the private sectors, and to the ART if they are found to be positive. So yeah, that's it from my end.
Thank you so much, Amit. What a very, very nice work that you are doing. Thank you so much for continue doing what you are doing. So our next speaker, last but definitely not least, is Dr. Nitaya. Hello, Dr. Nitaya.
Hi everyone.
Hi, can you introduce yourself, doctor, before I ask the question?
Sure. My name is Nitaya Panupak, and I'm the Executive Director of the Institute of HIV Research and Innovation, or we go by IHRI, which is based in Bangkok, Thailand. My pleasure to be part of the panel up here today.
Thank you so much, doctor. The pleasure is on ours to have you in this webinar today. So one of the focus that IHR is working on is chemsex, and it is relatively a new phenomenon with limited evidence from our region. Could you shed more light on the chemsex phenomenon in our region and its implications?
Yeah, yes, I feel that chemsex is part of the aspect of services in which like we serve a person as a whole, and that is what is kind of like bring IHRI into working with youth as well. So I would say that here like I'm very impressed with hearing what the other panelists have described their work, and I have to say that I'm grateful to be able to work with a team of youth who are innovative, because it's not like all youth are automatically innovative. we have been working with youth who are quite conservative, who are not ready to like come out of like the condom only box, being a poster child. So that's one thing that I just would like to mention before I go into chemsex. And yes, because we just had a Asia Pacific chemsex symposium last month on the 6th and 7th, and that's the first time that it happened outside of Taiwan, although it has been in Taiwan for 5 years. And I think I think we have two strong findings from the symposium. First is about pleasure. And I think like youth is the best person who will be talking about pleasure, because people engage into substance use because of pleasure. People engage into sex because of pleasure. And when chemical and sex comes together, then if we are not talking about pleasure as a way to engage people into services, and we are still falling into the same trap of using the risk-based approach that will go nowhere. So that's one thing. But pleasure is also complex, but it gives us like positive possibilities, right? And then the second findings from the symposium is around a strong community leadership, in which here I think like it really falls into the theme of take the right path here, right? Because I always feel that yes, when we talk about like community leadership, as a community person, as youth communities, I think we really need to focus on the 30, 80, 60 targets to get like community leadership or youth leadership in 30% of HIV testing and treatment, 80% of prevention, and 60% of enabling environment. And I think the part of enabling environment for me is very important in terms of chemsex. It's not too challenging to provide testing, PrEP, and all the STI management as part of harm reduction package. But in order to deal with the legal harm surrounding chemsex, I think we really need to talk more about decriminalization, and it's decriminalization that will need concerted efforts from everyone. So I think that's the two main points that when talking about chemsex now, I think we need to talk pleasure and we need to talk community leadership and decriminalization. Thank you.
Thank you so much, Doctor. That is such a great point to be highlighted during World AIDS Day celebration, is that even in a very new issue such as chemsex, it's all literally still about community leadership. So eventually it will always be about us, the community, the youth leaders. So once again, thank you so much, Dr. Nitaya. It's such great to have you here now. So that is our moderated discussion. Thank you so much, everyone. And now I'm passing it back to Dr. Pauline.
Thank you, Agatha, and also the excellent panelists that we have, all that are young, and even if you're older, you're still young at heart. So we have the results of the Menti, what it means by my right, my health, and if I can ask the team to show the cloud. What does it mean to the participants? And we have this: self-care, activism, responsibility, empowerment, access, equity, equality, accessibility, well, sexual rights and pleasure. We see this, the value of life, insurance, impressive presentations, and a non-negotiable right. So it's about action and it's about realization. Oh, I see more and more people. Okay, we are getting inspired from our panelists of speakers, and you can still continue to put more of your words, what you think on this, and keep it coming. So we hope that well, we have to finish up the webinar right now, but I would just join us to thank really the excellent panelists of speakers. But I have to say that, in this webinar, it has been an absolute dream team. It's a dream panelist of young people, young speakers who advocate, who are activists, who are the stewards and leadership, but also the allies that work to support the young. We are interested in understanding the diverse voices and the range of work and championship that is going in every country in the Southeast Asia region. So thank you so much, and thank you for joining us and making sure that well, no one is left behind. So we have another 6 years to the SDG. We still have time to accelerate, to work together, and as Dr. Nitya said, make the innovations work concretely and to reach as many people as we can. Thank you for joining us together. Thank you very much to all, and join us to clap for the panelists. Thank you very much, and I wish you a happy year end, because it's now December, and a year end season greetings to everyone. Thank you all. Bye.
Thank you. Bye.
Bye.
Bye.